Hi everyone, my name is Dr. Brian Toy. I'm one of the retina and uveitis specialists here at the USC Roski Eye Institute. I have the pleasure of being joined today by my colleague, Dr. Nguyen, who's one of the cornea specialists here, and we'll be talking with you a little bit about how COVID-19 can affect the eyes.
Hi everyone, I'm happy to be here today.
Okay, so Dr. Nguyen, we've gotten a few questions about COVID-19, and the first question is, if COVID-19 droplets land in your eye, is one susceptible to infection?
That's a very good question. The evidence of ocular transmission has not been very well studied. However, we know that mucous membrane, which typically line body cavities and organs, including the respiratory tract and the surface of the eye, they're susceptible for viral transmission and infection. Not just coronavirus, but all viruses in general. And, theoretically, if an infected droplet were to land in the eye, you are possibly susceptible to the infection. However, the mode of COVID-19 transmission is still believed to be primarily through the respiratory tract with droplets from person to person. However, the virus can live on surfaces for a few days. Therefore, if you touch an infected surface, then touch your eye, nose, or mouth without washing your hands, that could potentially lead to infection.
That's really helpful information. So some of our other patients and colleagues have asked, can cleaning the eyes with water or over-the-counter eye drops decrease the chance of infection then?
That's a great question as well. The ocular surface has its own protective mechanism, including antimicrobial proteins and natural lubrication. Therefore, routine cleaning and flushing of the eyes with water is not necessary and not recommended. It may actually strip away some of the ocular surface natural protective barriers, leading to increased risk of infection, possibly. So, however, if your eyes do become irritated or red, using over-the-counter artificial tears may be helpful to alleviate your symptoms. If your symptoms are persistent, however, you should contact your eye care provider.
Great. Do you have any specific advice for contact lens wearers?
So with proper hygiene, there's no evidence that wearing contact lenses in itself increases your risk of infection for COVID-19. However, contact lens wearer do tend to touch their eyes a little bit more, inserting the contact lens, removing it, and whatnot. Therefore, if you do have a tendency to rub your eye or touch your eye throughout the day, it's best to probably switch over to glasses temporarily, given the risk of transmission from rubbing without proper hand hygiene. Also, glasses also serve as a barrier in a way, forcing you to pause to consider before touching your eyes. And in addition, although not the best protection, glasses can also serve as a partial shield from respiratory droplets. If you do choose to continue to wear contact lenses, just make sure you adhere to strict contact lens hygiene and wash your hands. If you do develop redness or irritation, I do recommend for you to discontinue the contact lens wear immediately and contact your eye care provider.
Some patients have been asking, is it true that pink eye can be an early sign of COVID-19?
Yes, from early data, pink eye or conjunctivitis has been reported to be a possible sign of infection from COVID-19. It is still uncertain exactly what percentage of patients with COVID-19 have ocular manifestation, and different sources are reporting different numbers. Therefore, if you have any ocular abnormalities such as redness with uveitis symptoms, it's best to contact your primary care doctor. If there's any vision change, then definitely call your eye care provider as well.
Can COVID-19 be transmitted through tear droplets, and is this something that we should be worried about?
So transmission through infected ocular tissue and fluid has been controversial, and not a lot of data is out there yet at this point. So novel coronavirus has been detected in tear samples in a small number of cases. Given presence of these viral particles, it is therefore possible to transmit the COVID-19 through tears and through the ocular surface, although the risk is probably likely relatively low. However, the infectivity or the clinical significance is not known, and additional studies are needed at this time.
So if a patient does get infected with COVID-19 and it does affect the eyes, is the damage that it causes temporary or permanent?
So although conjunctivitis, which is a temporary condition, has been linked to COVID-19, at this time, permanent eye damage or vision loss from COVID-19 has not yet been reported. If a patient were to be in respiratory distress long enough, or if they happen to have a stroke, from blood clots from infection being thrown off to the brain or to the eye. Theoretically, poor perfusion and oxygen deprivation could lead to permanent damage to metabolically active tissue, including the optic nerve and the retina and the brain, which can lead to vision loss. This has not yet been reported in COVID-19 related cases. In this instance, eye damage or vision loss would be caused by decreased oxygenation rather than the virus itself.
So Dr. Nguyen, thanks for spending time with us to answer these questions about COVID-19. Are there any other thoughts or advice that you might have for our patients?
Actually, do have one question for you, Dr. Toy. As a uveitis specialist, what advice do you have for patients who are taking immunosuppressive medication at this time during this pandemic?
That's a great question, and a lot of our patients have been asking that. So patients who are on immunosuppression might be more susceptible to COVID-19 infection. So it's really important to continue adhering to physical distancing measures to minimize their risk. It's possible that we might want to modify your medication regimen. And so it would be important to speak to your uveitis specialist or rheumatologist about this. However, in the case of most patients who are not ill, the risk of vision loss from uncontrolled eye inflammation is greater than the possible increased risk of acquiring COVID-19. Well, thank you all for joining us today for the session with Dr. Annie Nguyen to discuss some of the ophthalmic complications of COVID-19. As always, if you have any issues with your eyes or your vision, please feel free to reach out to us at the USC Roski Eye Institute.